Luis is a 36-year-old non-English speaking Hispanic male who was diagnosed with acute lymphoblastic leukemia in August of 2014. Due to the cytogenetic profile determined at diagnosis, Luis immediately began treatment on the adult and young adolescent protocol, which is a very extensive treatment regimen that for males lasts over 3 years in length. At the time of diagnosis, his initial hospital stay lasted for 37 days. I met Luis when he came for his first outpatient clinic visit to the HTC, which is the hematology and transplant clinic where I work. After discharge, Luis was instructed to come to the HTC twice a week. Being his primary nurse, I felt that it was important to form a trusting relationship with this patient. I learned that he came to Ohio to live with his sister and her family, gain employment, so that he could help provide for his wife and daughter who remained in Mexico. It was while he was on his way to his first interview in the United States that Luis ended up in our ED, which resulted in his admission. Luis confided in me about his lack of financial resources. Because of the ongoing chemotherapy that he was going to be receiving, I knew it was going to be very difficult for him to find a job at this point. I was also aware that it was going to be important for him to keep maintaining a good nutritional status, which of course costs money. I was able to assist him by setting him up with a local food bank so that he could get a free case of Ensure each month, and gave him information about local reduced-cost farmers markets. Transportation was also going to be an issue, and I asked our social worker for assistance getting him connected to the Columbus Cancer Clinic for support. All patients require collaboration with other disciplines for quality care. Some just need more collaboration than others. Knowing the importance placed on the Hispanic male to provide for his family, I made sure to address Luis's mental health. Since he had no income to contribute to the sister he was living with, I was mindful of the potential for depression, anxiety, and stress. Sure enough, one day he came into the clinic with his hat pulled down. He answered my questions with only 1 or 2 word answers. And my nursing experience has taught me that nonverbal cues are just as important as words that are spoken. Having already established my role as his primary nurse, I pulled up a chair and started asking him some questions. Nurses often gloss over mental health questions when assessing patients because it can be uncomfortable. However, studies that I read have shown that mental health is significant to a person's recuperation and recovery. My thought was that he may be more and more withdrawn if his mental health was not addressed. Being culturally competent is not only recognizing that there are differences between cultures, but it encompasses gaining knowledge about each culture's uniqueness. Available literature reports that Hispanic males are the dominant figures in the household, but Luis has had to rely on his sister and her family to meet his needs. His sister called him lazy because he wasn't helping around the house. He was not only struggling with fatigue from his chemotherapy treatments, but he was also starting to feel some depression. Research also shows that in many Hispanic families, depression is often mistaken for fatigue, and in Luis's case, his family just didn't understand what was happening to him. I asked if his sister was able to come to the clinic so that I could provide her with some education, but he told me that she had taken on a second job to help with his needs, which I surmised was also contributing to his sadness. Everything Luis told me to this point guided the patient education that I wanted to provide to him. I not only gave him information, but printed some patient education handouts in Spanish that addressed chemotherapy-related fatigue, nutrition, and depression. I asked him to give them to his sister and have her call me using our interpretive assistance line if she had any questions. One article that I read describes a holistic nursing approach where the goal is to provide care via assessment of the whole person. For Luis, this meant not only helping him manage the obvious physical side effects of his chemotherapy treatments, but also addressing the emotional turmoil and family changes that were a result of his diagnosis. I talked with the interpreter who was in the clinic with us that day and asked if she was aware of any support groups for Spanish-speaking cancer patients. She was able to provide me with information about a monthly meeting that I thought might interest Luis. I scheduled transportation for him through the Columbus Cancer Clinic so that he could get to that first meeting. Luis also confided in me that he has a niece who lives in Alabama that he is very close to and happens to be the only English-speaking member of his family. We had a conference call that day with her, and she offered to assist us in providing information to the family when needed. She talks with Luis every day and recently picked up on changes with him that she was thankfully able to report back to our clinic. The language barrier has been a challenge with Luis, but I was very determined in the beginning to provide him with excellent nursing care, and I was able to find resources to help us overcome both his medical and his emotional obstacles. With the assistance of the social worker, interpreters, and our medication assistance program, Luis has been given resources for transportation, support, nutritional needs, and medication. He has been compliant with all his doctor visits, his medication management, and his mental health has greatly improved through this collaborative effort to provide him with excellent care. Even though Luis is a person to focus on, I think I've experienced professional growth by caring for Luis, assisting him not only with the struggles of his illness, but the struggles he experienced in his own support system really prompted me to always look beyond the disease. Wanting to give each person individualized care requires organizational commitment. When our patients can't verbalize to us their needs, whether it's because of a language barrier or maybe they just can't articulate effectively, we need to be their advocate and always strive to provide excellent nursing care.
Mr. C, an 83-year-old male, was admitted from an extended care facility to the James Cancer Hospital for surgical resection of his bladder cancer. When I met him 10 days post-op, he was critically ill after a recent cystectomy, prostatectomy, and uterectomy. Unfortunately, his midline incision had dehisced and stay sutures had been surgically inserted. He also had multiple healing lap sites and an ileal conduit placed to straight drain. After presumed aspiration, he began receiving tube feeding to assure adequate nutrition and improved healing. Mr. C was also having a great amount of liquid stool, so a rectal tube had been placed. He had developed a deep tissue injury, a fungal rash on his coccyx, and his tongue was dry and cracked. His extremities were extremely swollen, with his left hand weeping from an old peripheral IV, and an A-line that had been removed. A drainage bag had been placed on his hand to collect the oozing fluid. Mr. C also had dementia and was oriented only to self. He had garbled speech, he aroused easily, and had good eye contact, but could barely communicate verbally. First, it was evident to me that the patient was not receiving adequate mouth care due to the current condition of his oral cavity. I initiated mouth care every 2 hours. The current literature shows that hospital-acquired pneumonia has been linked to the bacteria found in dental plaques, so a lack of proper oral hygiene places patients at higher risk for pneumonia. Also, the importance of reducing pressure over Mr. C's bony prominences was clear to me. I know that pressure causes deep tissue injury, so I was sure to include frequent turns in his plan of care to prevent the deep tissue injury from worsening. I also recognized the drainage bag on his left hand could cause breakdown. Therefore, I made the decision to remove it. I see the prevention of pressure injuries as a nursing role and a measure of quality nursing care. At some point, the physician ordered the removal of the rectal tube. I quickly called him to explain that the patient was having very high output and that removing the tube would put the patient at a higher risk for skin breakdown as well as decrease the sacral wound healing. When I explained this, the physician understood and agreed to leave the rectal tube in place until the diarrhea stopped or slowed down. It was very important for me to include Mr. C and his family in his plan of care. I wanted to empower his family to take an active role in his care and voice their concerns. With every intervention I performed, I continually explained what I was doing and why to the patient and his daughter. I listened carefully to the daughter's stories of her relationship with her father, including their values and their beliefs. I answered all of her questions and addressed all of their concerns. Because I knew how close she was to her father, I realized that she needed to be included in his care. I encouraged her to speak up for the things that her father would want. I taught her the importance of frequent mouth care with a demonstration. I explained the importance of her father receiving adequate nutrition and why frequent turns were necessary. I medicated Mr. C adequately with the prescribed pain medication before we turned him as a request by his daughter. I evaluated how effective my teaching methods were by watching the daughter care for her father. She was very receptive and eager to be included in his care. In the mere 2 days that I cared for Mr. C, I developed a trusting relationship with him and his daughter. I feel that if each nurse performed basic nursing care, we would have a great opportunity to prevent pressure ulcers and hospital-acquired infections. It is our duty to prevent harm, so this is something that cannot be neglected even on our busiest days. This patient has reminded me over and over that the simple things that we can do as nurses can have a huge impact on the lives of our patients. I believe that being an excellent bedside nurse starts with good, basic nursing care. I try to be an example to my peers by demonstrating this every day. I will continue to protect my patients by assuring they all receive quality nursing care every day.